Thank you. Thank you. Okay. So thanks everybody for joining me this evening to chat about immunity, stress, and hormones um, and inflammation. Really, really important pieces here for what we're facing. A little, I'd like to start out with a little bit about who I am. I'm a naturopathic physician. I've been in practice. This is my 16th year of practice. What is a naturopathic physician? That's often a really common question that people have. So I have 5 years of medical school behind me, and our medical school is very similar to that of an MD. At least the first 2 years are almost identical. The following 3 years are spent in really hammering out nutrition and plant and herbal botanical medicine, Chinese medicine, homeopathy, really understanding getting to the root cause. So I call naturopaths the OG or original functional doctors. A lot of people understand what a functional doctor is, and that's a doctor wanting to get to the root cause. That's what we all want, right? We all want to understand the root cause. We're really sick of just being handed a prescription for medication. We're really even sick just given a pile of supplements. So getting to the root cause, understanding what we need to change underneath so that it affects our full picture is absolutely crucial. I own the Natural Medicine Center of Raleigh, and that's in downtown Raleigh. Although we often have people joining us for our webinars from all over the country, even all over the world. So we appreciate you joining us. Throughout this webinar, we'll be giving you an opportunity to book a free call with us. We call it a discovery call. It's a call that helps us understand what you're looking for. What are you trying to achieve in your health? And then we are able to let you know how we can help. And we do that for free. So, we'll be offering that opportunity throughout. We'll be posting that in the chat, the link to go ahead and schedule that. And let's see if I can get my slides. There we go. A little bit about our team. So that is me. And that is my husband, who is our posture specialist and pain specialist. And then we have Diane, who is our health and wellness coach. Amazing support she gives our clients. And then we have Julie and Amanda, who manage our office and are so there to help every client in any need that they have, help kind of triage any challenges or questions or needs. A little bit about what we're going to cover in this webinar. Of course, the burning issue at hand is COVID-19. So we're going to cover that. But what I really want to focus on is how this is showcasing our health crisis. This is more than anything we have seen in many of our lifetimes, how this is such a push on our healthcare system that it's now in crisis, which is why we're all staying home, why I'm doing a webinar instead of a dinner talk, that we're all, the stay-at-home orders that have been issued in many cities, many states. We're going to talk about inflammation and immunity. And then most importantly, we're going to talk about how you can take action to protect your health, but how you can do that naturally. Very important that we take action. There's also a Q&A inside this webinar that if you have any questions that come up, post it in the Q&A. And at the end, I'll take some time to answer the questions so that everybody can get that information. I want to go over a little bit about what COVID-19, what the signs and symptoms are, what this at-risk population is, what flattening the curve means, and how we can be proactive. It is so crucial that we are proactive instead of being reactive. We're thrown into this scenario right now of being reactive when all this whole time we should have been absolutely proactive in our health, getting as healthy as we possibly can from the inside out, from the outside in, doing everything we can. And that puts us in a place of less worry as this viral infection is spreading rampantly throughout the world. So symptoms, what is COVID-19 compared to the common cold, compared to the flu, compared to allergies? You know, here in Raleigh, a lot of people are coughing and sneezing. So it's causing alarm because we have allergies that are crazy right now. Yellow powder, yellow pollen all over our cars and our sidewalks. So there are people who are coughing and sneezing but what are COVID-19 symptoms? To be perfectly honest with you, a lot of people are asymptomatic. They are simply carriers of this virus. They have no symptoms whatsoever, which is why there's a stay-at-home order, because we don't know who has it and who doesn't. So fever is a really common first symptom. And then we see a cough, and it's usually a dry cough versus a wet cough. Shortness of breath is really common. And when you put those three together, that's really what they look for when they're looking to who gets a COVID test is, do you have a fever, a dry cough, shortness of breath? Now, what they are finding is some people are actually starting out with digestive symptoms. So that throws a little wrench in our picture here of, wow, now we have to think about people that are digestively affected. You know, common cold, we'll see a cough. We usually don't see a fever. The flu, the respiratory flu, common to have a fever, common to have a cough, not common to have shortness of breath in the flu. So when we put all this together, it's really important to see this list. However, you know, we're also seeing that children are very asymptomatic carriers. So we're spreading this everywhere. We really need to worry about the at-risk population. And who is at higher risk? You know, what we're finding is that it's older adults. Yes, we're finding some children, some infants. Same thing that we see with the flu is that older adults are affected more, you know, but we're seeing people who have serious chronic medical conditions like heart disease, hypertension or high blood pressure is a huge risk factor. Diabetes, type 1 and type 2. So type 1 is autoimmune, type 2 is acquired, and it's a system and a person really at risk for developing susceptibility to the coronavirus. Lung disease, of course. So anyone with pulmonary fibrosis, recurrent lung infections, somebody where their lungs are their vulnerable system, we're seeing that these kind of chronic medical conditions create an enormous susceptibility. You know, something that's really important and something that we preach all the time to everyone that we possibly can, but especially to our clients, is we want you to feel empowered. We want you to understand that you do have control. You have control right now. I know right now so many of us are feeling out of control and scared and what, you know, what do we just have to stay in our homes and until this all passes? And I just saw that the Virginia governor has a stay-at-home order until June 10th. We can't stay in our homes forever. We have to be proactive in our health, so much more than the coronavirus. You know, we don't even know if this is going to go away. Does it have the seasonality like the flu? They're not thinking it does. The seasonality, like the flu, where, we're coming out of flu season. We don't see the flu in the summer. And that's usually because vitamin D levels are elevated. People are outside, so they're breathing fresher air more, so not sharing as many germs. They're not seeing that with the coronavirus. So we really need to be proactive. Now is the time. If this isn't a message of get your health in order, then nothing is. So we do have control. We cannot stop aging. So, older population is more susceptible. We can't stop aging. However, we can be proactive. So, the thing that I preach probably more than anything is food is medicine. If our diets are on point, we have much, much, much better chance of staying healthy and preventing, more than the coronavirus, preventing autoimmune disease, preventing cancers, preventing digestive disorders, autoimmune conditions, you name it. Food should be always your first medicine. And something that I'll talk a little bit more later is that it is 70% of the immune system's in the gut. So if we're not eating right, that's the first thing that's cutting down our immune system. So we need to address blood sugar imbalances. The more we eat refined, starchy carbohydrates, the more our blood sugar is going to be fluctuating, the less our immune system functions properly. We need to improve heart health. Some of the biggest factors in heart health, like heart disease risk, we keep throwing cholesterol under the bus as the cause of heart disease, but really blood sugar plays a much bigger role in heart disease than cholesterol ever would. Blood sugar goes up, insulin goes up to manage that, and insulin actively damages the inside of those blood vessels. So to improve heart health, once again, we have to eat right. We have to control our blood sugar, control our insulin. We need to boost our immune system. Now, I'm not talking about just throwing a bunch of supplements at an unhealthy body. I find that useless. We cannot supplement you to health. And if there's anybody out there selling these quick fix, will help you, prevent the coronavirus, catching the coronavirus, or cure it with supplements, or, do not listen. That is not the case. We need to start with prevention. We need to minimize inflammation. Inflammation is key here. They are finding the most, the people that have the highest susceptibility are those that are inflamed. And inflammation takes many faces. Diabetes, cancer, like the things I was mentioning already. So autoimmune disease, gut disorders, bloating, it's all inflammation, joint pain, things like that. It's all inflammation. We have to calm autoimmunity. So autoimmunity is the immune system on overdrive. And this is a factor. People with autoimmune conditions do have a higher susceptibility with the coronavirus. That's some, type of people that we work with all the time are people with autoimmune conditions, whether it's Hashimoto's thyroiditis, whether it's Crohn's disease, whether it is lupus, rheumatoid arthritis, you name it. We work with people that have that. We've got to simmer that immune system down, get it functioning properly, get it activated in the right way, not overactivated. We've got to balance hormones. I do a lot of gut work, and I have clients all the time come to us for help with their gut disorders. And you can't have gut health. You can't have immune, regulation or a boosted immune system if you don't balance your hormones. Your mood's going to be off. They're intimately connected. So we have to do that. But you have to understand you have absolute control. There's no need to be fearful and hide away like a hermit forever in your homes we have the ability, we can be empowered, and it's important to feel that. A little bit about flattening the curve. You know, what you see here in the darker purple is the acceleration of the number of cases is rapid. And here's the perfect example of how our healthcare system is not the answer for chronic disease. It's not even the answer for acute disease, because we are running out of ventilators. We are running out of hospital beds. The system is crashing. Our healthcare system is not equipped for anything like this. And, you know, to be honest, as always, we had more deaths from H1N1 back in 2009. We had over 250,000 deaths for H1N1. And it just didn't have the acceleration that COVID-19 has. So the hospitals, they're closing their doors. And if you go in there for something smaller but hospital worthy, they're saying, we can't see you. So we cannot be in a susceptible place right now. We have to be in a place where our immune systems can take care of this. The reason we are, you know, socially distancing, we're avoiding groups, we're minimizing errands, we have stay-at-home orders, is to give the system a break. The system is not equipped. And they are just treading water, trying to help people who are really hit hard by the coronavirus. I mean, critically, trying to keep them alive. And so we are trying to stay indoors to keep this pandemic, keep the cases from accelerating, keep it accelerating, you know, more slowly so that the system can handle it. But our healthcare system, it is breaking down. This is the perfect example. I wish we didn't get to something like this, but this is the perfect example of the system not equipped to manage healthcare issues overall. You know, I hope everybody's washing their hands, singing happy birthday twice while you wash them. We've closed schools. We're all working from home. You know, we are considered in North Carolina an essential business, but, you know, we are taking it to heart as well and doing the majority of our work with our clients virtually. It's the cool thing about what we do. We have been very virtual and can absolutely take on new clients, manage the clients that we currently have, that we've had in the past, that we still work with as needed from a virtual standpoint, where people can work with us from the comfort of their own home. So we can still honor the social distancing, but help people get the goal, you know, reach the goals, get where they want to get. This should be your wake up call. I mean, if it, like I said before, proactivity, you know, it is crucial. Two things that we have to think about with this pandemic is two things that have to happen. You have to be exposed. That's number one. Now we're limiting that with everything that I just talked about. We're limiting exposure. But you also need to be susceptible. So we're trying to limit exposure. Sometimes we don't know who has it because they're carriers. But your susceptibility is where you can take control of your health. You don't have to get it. You can avoid it by reducing your susceptibility. And, you know, the way that we work with our clients is through these pillars of health. We like to call them pillars of health. They hold us up. They support us. Nutrition being number one. We can't do what we do without nailing nutrition. We individualize things so specifically for every individual client that walks in, because there are no two people who are alike, and they don't come in with the same issues. Even if two people come in with the same issues, you have different susceptibilities and genetics and things like that that make your makeup different than someone similar symptoms as you. We have to balance hormones, intimately connected, as I said. The gut and hormones are intimately connected. If we can't balance hormones, if your estrogen levels are elevated or you're not clearing them properly, you're going to be in an inflamed state. Fitness, we all need different fitness levels, and this is something that is really important to understand, that you know, your fitness level, it has to be geared towards your abilities. And once again, very individualized. Everybody needs something different. Detoxification, honestly, my favorite part. Detoxification, the word scares people, but it is so empowering and such an amazing period in our time when we work with clients. Their detoxification creates such an amazing result where they feel invigorated and energized, and bellies are calmed down, and they feel vital. And they go into it sometimes thinking, oh, it's going to be this time of deprivation, and, you know, oh, it's going to affect my digestive system. But detoxification is such a beautiful time, because what we're doing is we're cleaning the slate. We need to clean the slate if we're going to be able to get anywhere with your health. That is the magic. Why our programs work so well, get such great results with our clients, because of this period, the individualization, but the cleaning up of that slate, so that we can work from a really clean place. We get better hormone balancing, better gut healing when we do that first. We have to manage stress. That is such an important piece. Stress, hormones, and immunity. Stress, hormones, immunity, inflammation, they're all related. If we can't manage our stress, if we don't even recognize what our stress is doing to us, we're not going to be able to get very far in our health. So Diane, our health and wellness coach, who is you know, an incredibly active role in our every program, helping support our clients so that we can uncover how we can help you deal with your stress better, because we're all stressed, right? Every one of us is stressed. So we need to understand your stress. We need to test and see what your cortisol, your stress hormone levels are like. And then we also need to help manage those. We can't simply let go of all of our stresses. It would be wonderful if we could be stress-free. We just can't. Immune function, clearly. We need to boost immune system. I mean, that is, but we don't just do it with herbs. You can't just supplement your immune system and think that's okay. And then gut health. Once again, 70% of the immune system's, you know, in your gut. So, you know, if you're just tuning in, once again, we've been talking about COVID-19, but how our healthcare system is absolutely breaking down, the tie between inflammation and immunity, and how we individually can take action to protect our health, and how we can do that naturally. And I just wanted to put up the pillars again, just so that, you know, a reminder that it takes all seven to have, think of this as a table with a lot of legs. So 7 legs on our table. Think of if one of those was too long or too short, your entire table's still off balance. You need them all. To be successful in health, you need them all. I always like to ask everyone, you know, besides doing this for yourself, getting your health on track, getting your total health, you know, we like to call it reclaiming our health. What is your why? This is the perfect picture of my why. And, you know, in less than a month, I'm going to turn 50. And that picture was taken this winter. So, as you can see, we have young kids. So 7 and 10, second grade and fourth grade, and they're being homeschooled right now in second and fourth grade. But those are my babies, and I'm about to turn 50. So, you know, I have to work so hard to make sure, because that I am as healthy as possible. They didn't choose to be born to an old mama. So I was 39 and 42 when I had them. So they, they didn't choose an older mom. And I work so hard to make sure I'm in absolute the best health, and I do it for them. I urge you to think about who needs you to be your best health, who needs you to be thinking about them, to make sure that you're healthy, that you're in their life. They don't want you as a bystander in your life. They want you as an active participant. So I need to be just like the 25-year-old moms in the second grade class who, are incredibly active in their child's education and life. Maybe it's a spouse who needs you to be healthy. They need you around. But like I said, they need you in your best health. Maybe it's a child. Maybe it is a sibling, a parent, but they need you. So what is your why? Little bit about stress management. A lot of us think that, the emotional stress is the one that we think about as stress, but we forget about the physical stress. So, physical and chemical stress, I put nutrition, poor nutrition in that category. But physical trauma, car accidents, those affect our stress levels. They're just as important as the emotional stresses, the ones we think about. I've got a bill. Oh, I'm not well. I'm in pain. Those are emotional stresses. Stress management is very important in keeping your immune system under control. So stress, the hormone cortisol more specifically, which is the stress hormone, will degrade the immune response. Think about all the times you're under heavy stress, and either during that heavy stress or when that stress, right when it ends, you get sick. So most people I talk about, I know what caused my illness. I know what it was. It was a very stressful time. I was divorcing, or I went through a really rough time with family members or lost a family member. So many people on their intake paperwork or in our conversation are talking about how this one big stress caused their disease. A lot of food for thought. Nutrition. This is what I call the real food pyramid. So bottom is a lot of vegetables. Everyone's plate should be full of vegetables. 3/4 of your plate should be full of vegetables. I think those vegetables should be glistening in fat. The fat could be really high quality avocado oil, coconut oil, organic grass-fed butter or ghee. And, this might turn some people off, but if it's a very high quality animal source, whether it's lard or beef tallow, if it's grass-fed or pastured, it's a high quality fat to me. And we get great results with those kind of fats being ingested. I like dairy, nuts, and seeds to be a small portion, if any. That's tailored to our clients though, because not everyone tolerates those foods. Not everyone tolerates every vegetable. So to individualize this is a really key point in helping people get well. Remember, you have any questions, please put them in your Q&A. And, check your chat, because I know we're staying pretty active in chat. So any commentary in there. We're also offering an opportunity to book an appointment with us that is free. It's 30 minutes, gives you an opportunity to share what you're struggling with us. And we're also letting you know what our approach is, how we could approach your health to get you the results that you're looking for. Maybe you've seen a lot of doctors. Maybe you haven't even thought to see any doctors yet. So, this is a way that you can get some answers and understand what we can do to help you. Hormones, estrogen imbalance, absolutely very common. I see it in a number of people. So estrogen imbalance, your inability to break down your estrogen is a huge inflamer. What they are finding is inflammation in the body in the form of immunity, immune cells. Inflammation activates these kind of bundles, and they're called inflammasomes. And they're finding this in COVID-19, that these inflammasomes are an incredibly important piece. So they're activated, and the immune system's going back and forth trying to manage it. And so by doing that, the immune system sending out all of these cells, then it gets over, I like to use my hands a lot, then it gets overactive. So then the immune system tries to send out cells that are called Treg cells. Treg cells calm the immune system because they're finding kind of an immune flare to be a cytokine storm being a big factor in COVID-19. So these inflammasomes causing an overactive immune system, and then the immune system trying to calm itself down by creating these Treg cells. The Treg cells are created by the gut, by the microbiome. Estrogen can rule the microbiome. Estrogen plays a very active role in the microbiome, in what makes up that gut flora. So I already talked about the adrenal glands, stress glands. So cortisol plays that role. Thyroid right here. Thyroid is going to play a role in estrogen balance and adrenal. And then we throw that balance off, and now we have the liver. The liver's the filter of the body. Think of your car filter. You gotta clean your car filter. Your car's not gonna run forever if you don't clean your car filter. That's why we do detoxification, so that we can calm the liver, clean that filter, get the body working a bunch better. Fitness, please don't, this is fitness for the dog, but not for you. So fitness is crucial. Get outside on these gorgeous days. If you live in Raleigh, it is so pretty out lately. Get outside, get that vitamin D, breathe that fresh air, stay 6 feet away from your neighbors. But, there are people who are taking walks with their neighbors 6 feet apart. Do your best not to stay isolated. It's people are very isolated, and this is a time that we really can focus on ourselves during this stressful time. It's beneficial. Detoxification, definitely, clearly talked about that. Crucial role, clean that liver, get that immune system functioning better, get the liver functioning better. It'll help balance a lot of things from hormones, cholesterol, and your body's ability just to filter medications and things like that. So even though COVID-19 is caused by a novel virus, we were talking about it is attacking healthy, so-called healthy people. We need this robust immune system across many areas. I was talking about Tregs and cytokines, and we need the immune system to function as it's designed. Amp up an immune response, which is what the fever is. They're finding ibuprofen may be very damaging and actually creating more of a cytokine storm. That's still new information. But when we lower a fever, our immune system's not able to use that fever to our benefit. So it is really important that we're letting our immune system function properly, but we need to have the right immune system in the first place. Need all those pieces together. Gut health. I just can't hammer this enough that 70% of the immune system is housed in your gut. You've got to eat right. You've got to have your gut feeling good. Your gut needs to be in a healthy place. One thing that I like to say, if you have bloating and gas, if you are a gassy person, that is not normal. I don't care what anyone says. Gas is not normal. It is common. But if you are a gassy person, if you produce gas and, in other words, have to fart a lot, then you are fermenting food in your gut. Some really common foods. I always like to give tips in my webinars. So some really common foods that can cause gas are the broccoli family. So broccoli, cauliflower, cabbage, Brussels sprouts. Asparagus can cause gas. Really common gas producer that a lot of people eat thinking they're doing the right thing is avocado. So don't go out and just stop eating avocado. If you are a gassy person, if you are a bloated person, those foods may not be the right foods for you. So don't just eat them because somebody tells you to eat them. Fruits that are really gas promoting, apples and pears. So if you have gut symptoms, you have diarrhea, constipation, gas, bloating, belly pains, things like that, think about eliminating those from your diet. We already should eliminate gluten. Gluten damages the gut in every single human. Look up Tom O'Brien and his research on the effects of gluten in a human gut. It causes cellular damage in every single person, whether you have celiac or not. Alessio Fasano is an Italian pediatric gastroenterologist. So what that means is he is a kid gut doctor. And his research is phenomenal in this. Gluten damages our gut. I personally think it's because we've damaged the gluten, that there's Roundup residues on pretty much every gluten you can find, even organic. There's Roundup residues, and Roundup is an absolute poison to our bodies. We've also genetically modified it. So I think that's why we react so strongly to gluten. But those are just some tips. If you have gut issues, you might want to look at those foods. Test, don't guess. It's so crucial here that, we're big testers. We love labs in our clinic. We don't ever guess and assume someone's stressed. We want to know how they're stressed. So what their cortisol is doing, how you process your cortisol, how you process your testosterone, how you process your estrogen. Your estrogen levels may look normal from when you get a blood draw, but when you look at the tests that we run urine tests, you're actually potentially not breaking that estrogen down. That will leave you inflamed. I see that a lot in men who are on testosterone or low in testosterone. I see this a lot in women of all ages, that they're not breaking down their estrogen. So it's putting them in harm's way for inflammation, for breast, uterine, prostate cancer. Again, these missing pieces are crucial, but two things that are really important here is that we've got to treat the whole person. So I like to think of people as wheels with spokes. So if you have constipation and you're seeing your gastroenterologist, that is one spoke. But what if your constipation is due to a thyroid disorder, but you don't have an endocrinologist over here? So you're seeing a gastroenterologist, but if somebody focused on you as a person, they're going to start putting the pieces of your puzzle together, because 94% of all failure is due to not having a system. And the system has to be easy. I mean, who's going to do it if you can't, if it's difficult? So really important proactivity here. Tell me I may remember, show me I will remember, involve me and I will understand. If you're not part of the process, you don't learn how to not need a doctor. And what I mean by that is, we like to promote what we call health independence. Our goal is to train each and every client that walks through our doors. We train you so that you don't need us long term. You learn exactly what it is that was happening, why you had the symptoms, what made them better, so that you can move on without needing us. Now, we're always available to help our clients. However, our main goal is to teach you so you can move on and do it on your own, kind of like a fledgling leaving the nest. That is our ultimate goal, is to help you gain health independence. You don't need a doctor to keep you tied to medications or supplements or things like that. So, like I said, if now is not the time to stop procrastinating, I don't think there ever will be a time. It's time to wake up. It's time to move forward in your health. It's time to reclaim your health. And in the process, you're going to boost your immune system and not have to worry about things like this in the future as much as those that are incredibly susceptible. So it's time to move forward. We would love the opportunity to see what your needs are, what you're looking for. So we offer that, as I mentioned earlier, we offer that as a free 30-minute call. And in that call, we're going to talk about what you're going through, what you've tried, because we want to know what you've tried. We see people who have seen 6 functional doctors. We see people who are just starting on their health journey. So the full gamut. So what have you tried? How we can support you. We have a whole team to support you. And then what is that plan of action? What does that look like? We book through Acuity. It's very simple. We can also book through those telephone numbers. Acuity makes it real simple. You can do it on your own. And you can check your chat for that link, which I'm sure has been posted a few times. But the power of a proactive approach, it's not just about the coronavirus. That is a, really big, how do I want to say, wake up call for us right now. We don't like to wait for these wake up calls at all. We hope to be on top of things. What we tell all of our clients that have worked with us in the past and currently is that you are so many steps ahead of people who haven't worked on their health, because your guts are already in, such prime condition, or we're priming it to be managing your susceptibility to all of this right now. But, we shouldn't look at this as, the end of life as we know it, but a springboard into if this doesn't go away, how can we prevent ourselves from getting it? But honestly, how can I just feel better? I want more energy. I don't want the belly bloat anymore. I don't want the diarrhea or constipation. I don't want the joint pain. I don't want to deal with the fatigue. I want to feel good. And that is our specialty. And we just happen to boost immune systems in the process. So, I absolutely appreciate you all joining. I'm going to take a look at some of the Q&A here and see if I can switch. Let's see. I'm just going to pop into Q&A here. So I'm going to answer some of these questions live so that everybody can benefit. So do you have a plan to help people lower glucose levels? We work with so many diabetics. Our plans, which are incredibly individualized, so we don't have one plan to help lower your glucose, but we have worked with so many different diabetic clients who were able to go from an 11 hemoglobin A1C, where 6.5 is the first step into diabetes. 5.6 is the first step into pre-diabetes. We have clients who have 11s. I've seen it as high as a 14 before in my practice. Like I said, I've been in practice 16 years. I've been around the block a little bit. So, you know, to help lower those, what we do is we retest that hemoglobin A1C. We don't wait for every 3 months. Sometimes we're testing every 2 to 3 weeks to make sure our plan is lowering it. I've seen as much of as a 1 point drop, like going from a 7.5 to a 6.5, putting them almost in normal range in 3 weeks. So it's pretty phenomenal. So absolutely, Wanda, we can absolutely help people lower glucose levels, but you know, you would be treated as an individual. So there is no one size fits all kind of program or plan by any means. Let's see. Let me see here. Do any of these cells in the microbiome and flora, or can any of them have an effect on the bloodstream? More specifically, blood platelet levels. My doctor says my SIBO and gut and digestive health has absolutely nothing to do with my low blood platelets. Gina, I would absolutely say that your doctor is wrong. For somebody who does a lot of gut work, absolutely, there is something that, you know, we'll see idiopathic thrombocytopenia. That is code word, medical word for you have low blood platelets, but we don't know why. So they brush it off as we're just not even going to act like it has anything to do with it. The microbiome has to do with everything. And I've absolutely seen low platelets in the blood brought on by gut disorders, for sure. Now, it could be brought on by other issues. So I can't say just work on the gut and magically your platelet levels will elevate. However, because there's so many facets that we have to approach, but being an expert in SIBO and gut health, I've seen it happen numerous times over the years that I've been in practice. So yes, definitely. Do you find that oral contraceptives have a negative effect on hormone regulation or the ability to effectively detox? Absolutely. There is a book by my colleague, Dr. Jolene Brighten, Brighten. And her book is, oh, darn. Give me 2 seconds. Of course, it was on the tip of my tongue. Jolene Brighten. I'm not afraid to Google. Her book is called maybe Diane, you can pull that up. Post-birth control syndrome. I don't have her book name right in front of me. Sorry, I see on a live webinar, I'm not afraid to. Beyond the Pill, that's what it is called, Beyond the Pill. She's done amazing research on oral contraceptives. And, you know, starting my practice 16 years ago and my training 21 years ago with a focus in women's health starting at 20 years ago, the effects of oral contraceptives have been very obvious. So it has a dramatic negative role in thyroid, in the sex hormones, so estrogen, progesterone, testosterone, the adrenal glands, and they're finding these are long-lasting effects. We already know that the stroke risk increases, breast cancer risks increase, all sorts of stuff, blood clotting increases, but, they're finding more specific effects even on the microbiome. So it is a drug that the liver has to detox. So absolutely, you cannot effectively detox. Now, let me be clear. I do not request that our clients get off of their birth control pills, because I will tell you one thing. If birth control pills are used for controlling birth, it works really well. If birth control pills are used for regulating periods, there are better ways. I've helped tons of women over my years of practice get off of birth control and help regulate their period. But if it's used to control birth, in other words, you don't want to get pregnant, there are workarounds. You're not going to, detox as well as someone who's not on birth control, but I do understand the need for birth control in some situations. So I don't ever recommend everyone should just stop. That is case by case basis. So you are welcome, Wanda. I'm chipping away here. Let's see. You are welcome, Gina. The antibiotic, I wish I could tell you, trust me, in Oregon, where I had a practice for 13 years, I've been in Raleigh for 3 years. I'm a Kentucky native. So here in Raleigh for 3 years. In Oregon, I had full prescribing rights. My scope isn't fully recognized here in North Carolina, but I had prescribed Xifaxan. And numerous times, as it showed great promise, even in the naturopathic world. It is an antibiotic used to treat a gut disorder known as SIBO. I wish I could tell you it's effective. I've seen it lower numbers only to not relieve symptoms. So I've seen numbers go down. I have seen numbers go down, but symptoms are still there. So what I have found in SIBO specifically is that those the relationship of numbers going down and improvement of health, it doesn't happen that way. So I have gone about it a different way, and found that killing bugs, killing those SIBO bugs, whether it's herbal, Xifaxan, metronidazole, neomycin, all the ones that are written up, I wish I could say they help people feel better. So I have a totally different approach than my colleagues, which gets, I find, much better results in the SIBO world. We do much more healing of the gut up front. Not that we don't work on the bacterial overgrowth, we work on it, but we work on healing the gut, which helps calm the overgrowth in itself. And we get much farther with reducing symptoms. I used to test people over and over and over for SIBO. I'd test, give a treatment plan to kill bugs, retest. Give a treatment plan to kill bugs, retest. And, my colleagues, I see a number of colleagues who do that still. Sometimes people come to me with 7 SIBO tests. And guess what? They're coming to us because they still feel like dirt. And here they've had 7 tests with 6 rounds of antimicrobials or antibiotics like Xifaxan. And they still don't feel better. It's not the answer. I wish it was. So I'm not saying that that's going to raise your platelets. I don't know that that is going to be the answer. That I feel that you're going to need a little bit more than just killing those bugs, but I'm just being honest. You are welcome about the birth control question. I'm happy to answer it. Let's see. What's your take on the CMOS trend? I would not put it past anything being able to help improve health. I don't follow any one trend. I'm not saying there's not value there in CMOS. However, I don't just supplement one of those pillars. So the question is, what's your take on the CMOS trend? Does it help with any of the 7 pillars? So, you know, I don't take the approach of throwing certain supplements at pillars, if that makes sense. So, not saying that there's not value there, but it's not something that I would just throw at one of the pillars hoping to get an answer or a result in that way. So I hope that answered it well enough. Can you have a false positive SIBO test? Absolutely. We run SIBO tests in our office. I've run my own SIBO test for over 8 years. Absolutely. But then you can also have a false negative. So I use SIBO tests, look at those with a grain of salt. That is not my end all be all. Oh, there's the diagnosis. Therefore, if we treat this, you will be better. I haven't seen it happen. SIBO to me is a symptom. It's there because it can be there. It's an opportunist, just like Candida or yeast is an opportunist. So, you know, you could have a false positive. You could have an accurate positive. It is, it's not the end all be all answer to your health problems. That I can guarantee, because it's so much more than that. So, you know, I like to be an open book. I like to be incredibly transparent. I love what I do. My team loves what they do. We are incredibly motivated and supportive. We like helping people. Unfortunately, we can't accept everyone into our programs because we can only work with people who are incredibly motivated to get results, because then we see amazing results happen. But it has, you know, the people we do work with, we're like family, because we're incredibly invested in them as much as they're invested in working with us, and our active mentorship, you know, working side by side, holding hands, if you will, and helping them understand. I mean, we even give our own cell phone numbers out. Our clients can text us, you know, Diane and I, 7 days a week, 7 a.m. to 7 p.m. Well, you can text me more than that. But I just, you know, turn my phone off at 7 at night. You remember the picture of the small children? I do have, you know, some sense of boundaries. So, but, you know, I tell people you can text me anytime. I'm up at crazy hours like 4 a.m. That's my quiet time. So, but I thank you all so much. I'm excited that you joined us here on my webinar. My plan is to have more, and this has been my webinar just because so many people are very interested in this information. But you know, I will have a gut webinar soon. Thyroid, these are all things that we work on, but I urge you to stop thinking in a narrow box of, I have a thyroid disorder, I just need to work on my thyroid disorder and then I'll be better. Once again, the wheel. You cannot work on the thyroid without addressing nutrition, gut, detoxification. You're not going to get very far, very deep into the thyroid. Same thing with bloating, with digestive disorders. So there's, you know, I urge you to think outside of just the narrow focus of the disorders that you're dealing with. That's why, you know, while I start with COVID, this is not about COVID-19. This is about reclaiming your health. COVID-19 is just, you know, our big issue of now. You know, be prepared from a healthy standpoint to just be able to live your life from a place of empowerment and true health. And let's see. I have a, you are welcome, Shannon. Thank you all so much for joining. Much appreciated. You know, reach out to us. We would love the opportunity to chat with you, see how we can help you and what's going on in your life. Okay, thanks a bunch, and stay tuned for more videos, more webinars down the road.